So now symptoms, unfortunately, at the first stage of the disease, we have no symptoms. You will not have your eyes will no pain, your vision will be normal. But and at the end of the disease, or maybe 10 years after you're having the glaucoma, you will start having some kind of symptoms. For example, as you can see in the picture, in the inferior part, left inferior part, uh, you can see almost a normal view, but the peripheral, the corners are getting dark, and that's the first symptoms we can have. People with glaucoma start losing their peripheral vision first, and in extreme glaucoma, as you can see in the last picture, they will see just like if they were in a tunnel. So it is quite typical, and in the other images, of course, you can see the same picture. And how is detected if there are no symptoms? First, you have to go to the ophthalmologist. The diagnosis is completely clinical, so the ophthalmology with a delayed exam can see the optic nerve disc. So now in the right part of the slide, that's how we see the optic nerve in the lamp. So at the in the left one is a normal one, and the right one, as you can see, is a white part, more bigger. We call it the excavation, and this is a patient, of course, with a glaucoma, almost with a loss of more than 90% of optic nerve. After that, if we find a person with some risk factors or with this finding in the optic disc, we can do some type of test, as you can see in the below part of the slide. The first one is the visual test, field test. The second one is the optical coherence tomography and the HRT. All three are always for really good help for the ophthalmologist, for follow-up and for the diagnosis of this disease.